of the things that I think makes our system different, you know, I often say to people, no one in their right mind would ever design a system like the US health system in the way it has evolved, because it just is not efficient, and in a sense, it works in opposition to doing what you're trying to do at Kaiser and what you're trying to do with the merger with Aetna, and what you're hoping to do in terms of this new model of a community-based, more affordable care. Our health-based system here is really based on opposition. Payers and providers, you know, PBMs and drug makers. Everyone's sort of fighting to sort of say, I'm the one that's bringing the value, you're the one that's causing the problem. How do we solve that? Do we solve that just by, in a sense, we get married and we all just become part of one family and vertically integrate so we don't have to spar as much?
Well, Bertha, listen, I admire what Bernard has done at Kaiser, because I think he has created the framework for a solution in that, you know, he is centering healthcare around, you know, the patient. And I think the challenge that we have today is you look at healthcare, it's a series of transactions, and, you know, who's connecting the dots across those transactions versus the opportunity that we have to provide care management, you know, to, you know, patients, consumers, individuals. Those words are all starting to get blurred now. And yeah, and I think that's the direction that we need to go. We need to take healthcare to where, you know, the people are, okay, to the communities in which they live and work. And it's the opposite today.
So in our system, we all think that it happens through competition. If you succeed in setting up what is sort of essentially a different kind of model of almost primary care in the retail setting, in most every neighborhood where there's a CVS, and there are a lot of neighborhoods where there are CVSs, they're coming to mind, thank you very much. Does that then threaten the hospital? Does that then threaten the physician's office? The AMA just sort of came out in opposition to your merger, feeling that it threatens them in a bit.
No, you know, Bertha.
Let me put two mics on that then.
Let me go back to, you know, Bernard, you know, talked about, you know, that patient with diabetes, okay? And, you know, if we play that out here for a minute, because I'm sure everybody here knows someone, okay?
Or hypertension.
You know, well, you know, that patient is probably going to the physician, you know, 3-4 times a year. They leave the doc's office with a care plan, and if they're, you know, patient with diabetes, it's medication, it's diet, exercise, nutrition. And here's where the system breaks down, because, you know, no one knows what's happening in terms of, is that patient following that care plan, you know, in between visits. And the fact that we're in communities all across the country, we believe that we can fill that void, and we can be a complement to, you know, the work of the physician, you know, the work of that patient's medical care team, you know, to keep them adherent, you know, to that care plan, because the studies are out there, and there are folks here, you know, in the audience that have written them that, you know, have quantified the fact that, you know, there are significant numbers of, you know, patients with chronic disease that are not following that care plan. It's costing our healthcare system billions of dollars every year in avoidable and unnecessary costs, but at the same time, we're not helping those individuals achieve their best health. So I don't see this community-based model as a replacement for, you know, hospitals or physicians. I see it as a complement, you know, to the work that they do, because of the voids that, you know, we see going on all around us in healthcare today.
Yeah, I would second that. I think that one of the things that we have to be careful about, you know, first of all, in my narrative of recrafting how we think about health and healthcare, in no way do I want to diminish the great work that's been going on in the healthcare industry. You know, as I'm talking to you right now, I promise you with my own statistics, my doctors and nurses, most wonderful people They're operating on a patient right now, and they got the chest open, and they're going to do this great heart surgery. And that patient is going to be up in the next couple of hours walking around. And in our system, because of all the wraparound services, they'll probably be going home in the next couple of days, starting a brand new life, right? So to that patient, they're going, this is a great healthcare system. To the innocent one who may pass out in the streets, that now in the healthcare industry, we could diagnose you immediately and figure out what to do about you. We're living in a day and age where we have figured out how to cure a certain illness. So great progress. But that's a very expensive system, and it's focused on sick care and fixed pay. And what we're describing here is a whole new ecosystem of health where it comes together as a whole system as opposed to is siloed now in each part of the industry. And we have a real opportunity to innovate and redesign the whole healthcare landscape.